Hi, I'm Marigold, and I'm here to find the answers to the questions you've long wanted to ask about plastic surgery.
My name is Dr. Esteban. I'm a plastic surgeon with Plastic Surgery Associates.
Hi, Doc.
Hi.
Can you tell us why it's called plastic surgery? Are there really plastics involved in it?
Well, actually, plastic surgery, the word plastic comes from the Greek word plastikos, which means to mold. So it's basically to shape, reform. That's the base word. That's why we call it plastic surgery. Well, plastic surgery is actually a very broad field. You know? We have cosmetic surgery, which is of course very popular nowadays. And then there's reconstructive surgery, which deals with restoring form and function after trauma or after removal of tumors, or reconstruction after infections and all that stuff. So they're actually different fields, but it actually covers the whole body from head to toe. For most of our patients are usually women, no? But actually we do have a lot. I would say maybe about 30% are male.
Talaga?
And the most frequently requested procedures is liposuction and hair transplantation. Of course, these are concerns, men's concerns, and also removal of the eye bags. So for men, it's a little bit different, though. These are what they're concerned about. Once in a while, we have also rhinoplasties and facelifts for men. And then for women, most commonly requested procedures are liposuction, and then the nose lift, also the removal of the eye bags, and of course breast augmentation or a bust lift. These are also popular.
Is this what you call sclerotherapy? What do you actually do there?
Well, with sclerotherapy, we actually use a sclerosing agent, that we inject into the vein itself. So it's very effective because the solution actually irritates the insides of the vessel, of the blood vessels, and then after that we do compression. So you have to wear compression garments or elastic bandages para maipit yung vein, and then eventually to close and heal up. These are especially good for spider veins or varicose veins that are grade 1 to 2, depending on the severity. Of course, the more severe ones would probably need surgery also.
I'm Dr. Cherry from Plastic Surgery Associates.
Are there people who shouldn't undergo plastic surgery because of the expected complications?
People who have problems or diseases of the skin, like what we call dyslaxa, these are inherent diseases that if you do surgery, you might not get the expected results. But the most common would be patients or people who are prone to keloid formation. Keloids are scars that are raised, angry looking. Picture a caterpillar that grew on your scar, and that's it. It's painful, it's red, it's very, very angry looking. So those people who have the propensity to develop this, then we suggest or we try to caution them against surgery of the skin. Skin resurfacing, you only deal with the skin per se. Let's say this is the skin, okay? And these are the layers of the skin. Let's say this is the epidermal layer, and then this is the dermal layer, and this is the fatty layer, okay? With skin resurfacing, what you do is you like plane this down, okay? That's warranted if you have wrinkles, if you have acne scars. So you plane it down. You plane it down up to the dermis. You don't want to touch too much of the dermis because the dermis is the one that's responsible for regenerating it again. Alright? Now, in skin lifting, what you do is you cut down through there, up to the fat layer, and then dissect the fascia, what we call the smas, and then pull it. So that everything that lies on top of the skin is consequently pulled off. So it's more taut. So any laxity that you have on the face, like jowling or very deep nasolabial folds, get pulled in that process. Now, if it's just the skin that's involved, I mean like young person, but just the skin that's really sagging, very good looking, then you just pull the skin. So there's a difference between the two. The other one is actually undermining it. You lift the skin off and then you pull it back. The other one is just planing it down.
Okay. Have you watched the movie Face Off? Can that actually happen in real life? I mean, changing your face into somebody else's.
Copy somebody else's face is very possible, as we've seen with Michael Jackson. No? But to get someone's face, as in Face Off, and transplant it, we don't have that technology now, right now, at this time. And it's nice, it's a movie plot, but not in real life.
Okay.
So, only because if you want to copy a face like Michael Jackson wanted to copy Diana Ross's face, you will have to go down to the basics, to the bone level.
Yeah.
And you have to change all of that in order for you to create something that's similar to what you're copying. So it takes a lot of surgeries to achieve that.
Okay, thank you very much for your time,
Thank you.
Dora. Thanks.
Stay tuned, for in a moment we will show you how to enhance and design your skin.
In3 would like to thank the following: Cusinerong Pinoy, Restaurant and Grill and Catering Services. Profile Salon, the official salon of In3.